White House frustrated with RFK Jr.'s Department of Health and Human Services communications, a growing crisis. The White House is reportedly becoming increasingly exasperated with the ongoing communications breakdowns within Robert F. Kennedy Jr.'s Department of Health and Human Services, HHS, as sources within the Trump administration reveal a situation described as a mess. According to Axios, a series of issues with the department's media operations have sparked growing concern among officials, with the White House having to intervene on multiple occasions. At the heart of the issue is Stefanie Spear, Kennedy's loyal deputy chief of staff and former press secretary for his presidential campaign. Spear has been heavily criticized for overseeing a sharp decline in external communications from the department. The disarray reportedly began in January when Spear halted all HHS external communications, leading to an unprecedented delay in the release of the CDC's Morbidity and Mortality weekly report, which had been consistently published for decades. A key moment of tension arose on February 26 following a tragic measles outbreak in West Texas, which claimed the life of a young child. Despite the gravity of the situation, it reportedly took RFK Jr. 2 days to issue any public comment, doing so initially via a post on X, formerly Twitter. A more formal statement from the department did not come until 2 days later, only to be followed by Kennedy posting on social media once again to share his personal experience of hiking in the Coachella Valley. The delay sparked frustration among White House officials, with one involved in the crisis response revealing the intense pressure. The White House was like, "Where the fur is the statement?" This communication breakdown has reportedly worsened as further media challenges arose, including the abrupt resignation of the country's top vaccine official, who issued a scathing letter of departure directed at Kennedy. Spear was allegedly unavailable when the news broke, forcing the White House to handle the response and approve the HHS's public messaging. Compounding the issue, the White House reportedly stepped in to manage the fallout from a directive issued by Spear to avoid engaging with the media regarding sensitive topics, such as the investigation into the potential link between vaccines and autism, a controversial subject long associated with Kennedy. This decision led to a clash between the White House and HHS, with the White House overriding Spear's directive and taking control of the narrative. Further frustrations stemmed from the lack of press coverage for initiatives such as Operation Stork Speed, an initiative aimed at improving the nutritional standards of baby food. Despite the significant public health impact of the program, insufficient coordination between the department and the media led to minimal coverage and poor communication with reporters, further exacerbating tensions within the administration. Reports also indicate a deepening divide between Trump administration officials and career employees at HHS, who are generally more liberal. The friction has contributed to the dysfunction, with career employees reportedly leaking information to the press and resisting the current administration's directives. One White House aide described the situation as a mess, highlighting the difficulty in managing both internal opposition and the strained relationship with the media. In response to the growing concerns, alternative press teams have reportedly been working in parallel with Spear's team to ensure that media output is managed more effectively. A White House advisor commented on the situation, stating, "This shouldn't be the White House's job, but here we are," underscoring the severity of the issue. Despite these efforts, Spear, along with the White House and HHS, did not immediately respond to Axios' request for comment.